I'm Dr. Cecil Bennett, a board-certified family physician for over 20 years in Atlanta, Georgia. I am also a fellow with the American Academy of Family Physicians and a fellow with Morehouse School of Medicine, Department of Family Medicine in the field of healthcare advocacy. Some consider me Atlanta's primary care doctor due to the countless number of TV news appearances I have made over the years on health-related topics. Creating the Primary Focus comprehensive medical exam was born out of 20 years of patient and my own experiences. A sudden dramatic change in one's health is devastating. A sudden heart attack or stroke or cancer is life-changing, not only for the individual, but their family, loved ones, and colleagues as well. A devastating health event seems even worse when there appears to be no risk factors, to include being of a young age. How many times have you heard or said to yourself, that person died so young with no warning? Scenarios like this or similar were made real to me twice in my life. When I was 14 years old, my mother was diagnosed with metastatic colon cancer. She was 42 years old. This was heartbreaking news. As far as we knew, she had no risk factors for colon cancer, and she was so young, with no family history. My mother was the rock of our family. No decision was made in our home without her blessing. Within 3 months of her diagnosis of colon cancer, she died. Our family was now rudderless and aimlessly adrift for years after her death. Because of my mother's early death of colon cancer, I was screened via colonoscopy at the age of 35. Bear in mind that the age for screening at that time was age 50. At age 35, I already had 3 colon polyps that were quickly addressed. But suppose I had waited till age 50 for screening. Would I have made it to age 50? Another difficult time in our family occurred a few years ago. My wife was working with others at church preparing for vacation Bible school when suddenly she fell backwards, hitting her head on the concrete floor. An ambulance was called and she was quickly taken to the hospital. She had suffered a cerebral aneurysm. An aneurysm is a bubble that appears in the wall of blood vessels that, if ruptured, can cause sudden death. We all rode bicycles as children and know if a bubble appeared in one of our tires, it had to be addressed immediately to avoid a blowout leading to a dangerous fall. We can see bicycles with tire bubbles. We can't see a bubble or an aneurysm in our brain or in other blood vessels unless we get screened for them, which we do not routinely get. 50% of patients with a ruptured cerebral aneurysm, like my wife, do not make it to the hospital. Thank heavens my wife not only made it to the ICU, she was in a hospital that was a world leader in treating ruptured cerebral aneurysms. After 28 days in a coma and months of rehab, she made a miraculous recovery. I verbalize these examples because they are real, and I understand the apprehension you would feel if your loved ones were in a similar situation, and the fear they would feel if you personally were in one of those situations. Not all of us live close to a world-class hospital. Since my wife's incidents, 2 other close friends suffered ruptured cerebral aneurysms, and unfortunately, they passed away. I know there are folks with significant responsibilities that if they suffered a sudden disastrous change in their health, the impact would be life-changing, not only for them, but their loved ones right now and for an extended period of time. For some, your unexpected loss or crippling sudden disability could lead to family breakups, loss of a home, or your company going out of business. These are serious matters. These are the reasons why I felt the strong desire to create this comprehensive medical screening program that I am sure would save the life of someone that did not even know they were at risk. Why am I sure? Again, I've been a primary care physician for over 20 years. I've seen it all. This exam will save lives. I won't mix words. The exam is expensive and not covered by insurance. Most of our clients are business leaders, business owners, and financially successful individuals. So expensive is relative. If they could do something proactively that would save their life or the life of one of their family members, they would. If I could make the exam more affordable to the general public, I would. But unfortunately, technology is expensive. This is why we make financing available. The fact that insurance is not involved is actually a good thing. Why? The information gained from the exam is private and for your eyes only. Results are not reported to any health or life insurance entity. You decide what to do with it. Please review our website, email us, or call us. We welcome your questions.